I am Dr. Ejaz Urrehman, working as assistant professor in Department of Urology here in Government Medical College, and I am also GM site. Uh, all these all are respected teachers of mine, and this Iron Lady, Madam Naseem Saba, is my mentor. Uh, Today I am going to talk about one of my research, which is a chunk of that research on Duckett's urethroplasty. We did this research in comparison of Duckett's urethroplasty with Koenagi's urethroplasty. At Pakistan level, this was first time conducted study, and it was a huge study. So due to limitation of time, I am today presenting only a chunk of this, which will tell about cosmetic results of Duckett's urethroplasty. First of all, a brief about introduction. The hypospadia is actually a congenital defect in which this urethral opening is located a bit proximal to its original or natural location on the ventral aspect of the shaft and even just below the shaft sometimes. Glenn was the first person who divided or classified the hypospadia into anterior, middle, and posterior. Simply, if we take the middle one, it is at the mid shaft level, and rest anterior to it is anterior and posterior to it is in posterior group. Mostly 50% of the patient present with anterior hypospadias, 20% with middle, and 30% with posterior hypospadias. And it's in every 300 boys, we see one boy has this hypospadias, and association of hypospadia is 1:4 with Cordy. Cordy is actually bending of the shaft. It is bending of the shaft with hypospadias. This bend is towards the ventral aspect, and it is also one of the cosmetic derangement which is congenitally found with this hypospadias. More the hypospadias goes posterior, more is association with Cordy. And early management of these conditions adds to the self-esteem of the person and future performance of this individual. The goal of my surgery was to shift the opening of the urethra to the normal location and achieve a straight shaft, and by this achieving the good cosmetic results. As in urology, we say every male has right to wide at the tip. So we tried best to restore the original position of this urethra. And Duckett's urethroplasty is one of the technique which cover this disease with single stage intervention. The objective of my study was to study the cosmetic outcomes of Duckett's urethroplasty. The design of my study was descriptive. It was a single center study. The center of my study was Department of Urology, DHQ Teaching Hospital, Deir Ismail Khan KPK. And the duration was from 1st June 2021 to 31st July 2022. My sample size was 42, and my inclusion criteria was patient presented with anterior hypospadias to the OPD having Cordy as well. And the age limit was 2 years and above. The exclusion criteria was associated infections, conditions like balanitis, xerotica, obliterans, or any this blood diathesis. Now, brief introduction of the surgical procedure. First of all, we applied the traction sutures to the glands, and after that, we selected the area of surgery and marked the incision, which was one of the incision was given vertically from the hypospadias opening till the coronal sulcus, and then a circumferential incision was given at the coronal sulcus level. And by this, after that, all of the glands was degloved. The Cordy was released by transection of the urethral plate. After that, we reassess the Cordy, or at the reassessment of the Cordy, if we find any residual Cordy, that was covered with the removal of the rest of the bands at the shaft level. Then A rectangular area in the inner superficial skin was selected for new urethra. That rectangular area had 30% more distance, more length from the distance of Hypospadias to the tip, so as to cover any disparity at the length or the shaft place. Then this rectangular area was tubularized over a cylindrical catheter into a new urethra, and this new urethra was anastomosed proximally to this Hypospadias opening and at the tip distally to the tip of the glans. Then next step was glanuloplasty. A glans-like structure was constructed at the level of the glans, and post-operatively the catheter was kept for 10 days under the antibiotic cover. Protocols of my study were, we conducted these surgeries under general anesthesia, and this erection was assessed on artificial erection methods, and we followed up these patients at different intervals. The first visit was set at first month, then at third month of the surgery, and at the 6th month of the surgery. Now, brief discussion about the parameters which we set about at the results. The scale of this outcome was graded grade 1, 2, and 3. Grade 1 was described as 10% reduction in the circumference at the coronal sulcus level. Grade 2, the grade 1 also included the meatus located at the tip, and meatus appearing exactly vertical slit-like. Then grade 2 was 11 to 20% reduction in the circumference, and there is this new meatus was located about 4 millimeters below the normal site, and it was appearing in appearance it was just like a fish mouth. And then in grade 3, the reduction was more than 20% in the circumference, and the meatus was located more than 4 millimeter below, and the meatus was distorted in appearance. Now the chordae was, this was actually the residual chordae after surgery. It was graded in grade 1 and 2 and 3. In grade 1, the residual chordae was less than 20 degree. In grade 2, it was 20 to 40 degrees, and in grade 3, it was more than 40 degrees. The scarring was graded as grade 1 if it was hardly visible. In grade 2, it was little patchy scarring, and in grade 3, severe scarring with skin not mobile over it. The results were very good. In grade 1 at first month, we had 40 of the patients which made 95% of the group, and 2 of the patients were having grade 2 results which were 4.7%, and none of the patient was having grade 3 results. At third month, it was also static as grade 1. This first month visit, 40 were having grade 1 results, and the grade 2 results were in 2 patients, and none of the patient had grade 3 results. The results improved with the passage of time. At 6 months, we had all of the patient in 42 of the patient was in grade 1. Actually, the grade 1 was not 100% results. Here we see that the grade 1 results are, all the patients were in grade 1. If we go back, we can see in grade 1, we were having 10% reduction in the circumference. And this, the position was at the exact original location. So we can find these results as well. These results here we are presenting in graphical presentation. The blue color is showing the grade 1 results, and red color is showing grade 2 results. Now, hypospadia is generally managed by more than 300 procedures. Generally, if it is associated with chordae, usually urologists go for 2-stage procedures. In 2-stage procedure, patient has to undergo number of interventions, and more is the burden on hospital and economy. Patient usually want to be treated definitively in a single admission. Duckett procedure is one of the single-stage procedure with good results. So we can conclude that considering the follow-up results of this study, it is concluded that Duckett urethroplasty has a good cosmetic outcome, and it is suggested that Duckett urethroplasty can be opted on regular basis for hypospadias with chordae, It will reduce our burden, patient burden, and also will be beneficial for economy of this hospital. And then thank you on this results.